Hello, okay.
You are ready?
Yeah, I'm ready.
Okay, so 1, 2, 3, and
Station 2, right?
yes, it is written on clearly station 2. 1, 2, 3, and start.
Okay. How are you? Can I confirm your name? You are Mrs. Sarah, 62 years old.
Yes, doctor, I'm Sarah and I'm 62 years of age.
Yeah, I received that. I received from the GP letters that you are complaining of hard stool. Right?
Yes, doctor, you are right.
Okay. Can you explain to me more about this? When this started exactly?
Yes, doctor, basically it started 6 months ago, and
Okay.
I started to have hard stools, but gradually I'm having less stools. I'm having constipation also.
Okay. This constipation coming on and off or all the time with you?
No, doctor, from the last 6 months, it is there with me.
Okay, before 6 months you was normal.
Yes, doctor, before 6 months, I was normal.
Any associated symptoms with this hard stool, such as cold intolerance, lose weight, decrease appetite?
I have no cold intolerance. I have never
Okay.
lost weight, and my appetite is poor, doctor.
Okay. What about your diet? You, the eating habits per day, a lot of fibers. You eat a lot of fibers, or uh, the amount of the foods per day. It's normal
Yes,
or
doctor.
not? Hmm.
Yes, doctor. Basically, I try to take a good food every day, but nowadays my appetite is poor, and I don't like to eat more. However, I try to take fibers. I try to take meat whenever I like. Yes, I
Okay.
try to take a good meal. Yeah.
Okay. So you lose your weight, right?
Yes, doctor. I lost some weight. Yeah.
How many kilos?
Well, doctor, from the last 2 years or 2.5 years, I'm losing weight, and I have lost maybe 12 kilos in last 2 years.
10 kilo, yeah? 10 kilogram,
Yes,
right?
doctor. Yes, doctor.
Okay. Okay. Any blood in the stool?
No blood in the stool, doctor.
Okay. Any gastric pain, any acid brush, heartburn?
Epigastric pain, doctor. I don't know what is epigastric, but I do have pain in
Yeah.
my burning pain in my chest.
You have burning pain in your chest. Okay. When this burning pain started exactly?
Doctor, you can see it all started 6 months ago.
Okay. About the stool, you said that it is hard stool or stool with sometimes constipations or sometimes diarrhea, loose motion.
No, doctor, I never have had loose motions in the last 6 months. I am having constipation and hard stools, doctor.
Okay. You have epigastric pain, okay, and you feeling sick or getting sick with this epigastric
N-
pain?
no, doctor, I don't feel sick with this pain.
Any disease spell?
No, doctor.
Okay. Okay. Any associated symptoms? Any hot intolerance? Checking of your of hands or checking of the body?
Shaking of the body, shaking of the hands. No, doctor.
Any slurred speech? Any numbness or pain sensation all over the body?
numbness and pain and needles. Uh, no, no, doctor.
Okay. Any cough, any coughing of the blood, any noisy chest?
Coughing up of blood, noisy chest. No, doctor.
Okay. Any abdominal pain, any gas?
Abdominal pain, abdominal gas. No, doctor. Sorry. No, doctor.
Mm, no. Okay. You have any history of long-standing disease, diabetes, hypertension?
Diabetes, hypertension. Doctor, yes, I have diabetes, and I am taking
Yeah.
metformin for that, one tablet in the morning and one in the evening. And I take insulin, 20 units in
Yeah.
the morning and 10 in the night. Yes.
Okay. What's the last last reading for HbA1c or the last glucose level?
Yes, doctor, it was 5. We checked it a couple of weeks ago, and my GP was, I mean, we checked it like 6 7 months ago, and my GP was very happy.
Yeah. Okay.
And doctor,
Any
I
history of
also,
long stand? Yeah.
yes, I also have a history of breast cancer. Basically, 2.5 years ago, I was having cancer in my right breast. And yes, doctor.
Yeah. Yes. Okay. Okay. Did you check your eye? Any eye visual disturbance? Any eye problem during of vision?
Yes, doctor, I use glasses while reading, and I am using glasses while to read for last 10 years. No recent change.
Okay. Any muscle pain? Any skin rash?
Uh, no muscle pain and no skin rash.
Okay. 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 The constipation. We have to go back to the stool, hard stool. Okay. Any associated symptoms with this hard stool? Any changes in the bowel habits?
Yes, doctor, basically, you are right. Changes in the bowel habit. Yes, before 6 or 7 months, I
Yeah.
used to pass stools almost daily, or if not
Yeah.
almost daily, maybe on alternate day. But from last 6 months, I'm passing
Yeah.
stool maybe once or twice in a week.
Yeah. 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 Okay. Okay. Any drug list?
Yes, doctor, as I told you, I'm taking metformin.
Okay.
That is one tablet in the morning and one in the evening, and also I take insulin, and also
Okay.
I take some over-the-counter medications. What do people call it? Antacids because of my heartburn.
Okay. Okay. Uh, any other drug? Only this three drug, right?
Sorry, doctor.
Only these three drugs, right?
Yes, yes, doctor. Only these medications. I am
Okay.
not taking. Yes, I took. They gave me some other medications like chemotherapy for my breast cancer 2 years ago, and
Yeah.
also they gave me some radiations to my breast, and they did surgery of my breast. They removed my right breast, doctor.
Okay. 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 You said that you lose weight, right? 10 kilograms. The 10, it's intended lose weight or without intended intention.
No, doctor. Basically, it is unintentional weight loss. I haven't
Okay.
tried to lose weight. Yeah, rather I'm worried why I'm losing
Okay.
weight, doctor.
Any bone
Yeah.
pain? Any bone pain?
Yes, doctor. I have uh, pains and aches all over my body. And yes, you're
Oh,
right. Hmm.
okay. Okay. Any change in your mood?
Yes, doctor. Definitely, my mood has been very poor because I have cancer. I mean, it's a very horrible disease. Then now I got this constipation, and I'm really worried.
Okay.
Yes, my mood is low, depression.
Oh,
Yeah.
okay. Any increase thirsty or increase urination?
Well, doctor, I have noticed that I'm passing more water works from the
Yeah,
last couple of months, but I
yeah,
don't feel so thirsty. Normal. Yeah.
yeah, yeah. Okay, okay. Uh, Anything you want to add?
Like
Any
what?
renal story, any change of urine amounts, any pain during passing
Yes,
your urine?
I told you the change in amount. I am passing more waters than usual,
Yeah,
but I have never passed any stones, doctor.
yeah. Okay, okay, okay. You have any endocrinal disorder before? Any headache? Any change in facial habit? Facial feature?
Facial features? No, doctor. I was a very beautiful young lady.
Okay. Any
My
enlarged?
face.
Yeah. Any
No, no.
lumps or bumps all over the body?
Oh, yes, doctor. I have lumps and bumps. Two,
Where?
rather two lumps in my right armpit.
And you're right. And
Right
where?
armpit. Right armpit. Axilla armpit.
Ah, is it
Under the
axilla?
arm.
Yes. Yeah. Okay. Okay. Any lumps in your neck?
Mm, no, no, doctor. No.
Okay. Any disease spell or fainting attack or change in the tanning skin? Change of the color of your skin?
No, doctor. No.
Oh, okay. 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 What's your concern, though?
Concern? Yes, doctor. I'm really concerned. Do am I having bowel cancer because I had breast? You have 2 more minutes. I have
Uh,
bowel
can, can,
cancer.
can, can,
Yeah.
yes, okay. Can I ask you some questions? What's your job?
Doctor, I am retired basically. I retired 2 years ago. When I got breast cancer, I took early pension.
With whom you live?
I live with my husband and I live with my kids. I mean, my
Uh,
son.
okay, they are doing well, right?
Yes, doctor, they all are doing well.
Okay, do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay, any family history with a similar condition?
No, doctor.
No. Okay. Uh, you're concerned about these symptoms, right? The
I'm
hardest to
concerned.
do.
Am I having bowel cancer?
Mm, okay, we have to exclude the bowel cancer, but from our history, I have to examine you. I have to examine you first from your our history today. You seem to have elevation or increase in some minerals in your blood uh, called the calcium, elevation of the calcium in your blood.
Mhm.
This is related to maybe related to extension of the tumors to the other organ of your body, maybe
Mhm.
extension to the bone. Extensions to the bone make this increase in these minerals called hypercalcemia.
All
Okay,
right.
this hypercalcemia make these symptoms low mood, polyuria, polydipsia, increase
Your your
thirsty, increase,
your time finishes, but you can carry on. No problem.
okay,
So, doctor.
increase.
So, doctor.
Yeah.
Now, will you admit me, doctor?
What?
Will you admit me?
Uh, we have to make a lot of investigation first. We have to transfer you to multidisciplinary teams in the oncology
Mm-hmm.
doctor. oncology doctors, okay, and then we have
Mm.
to make more investigations. We have to see the serum calcium level in your blood. We have to check
Mm-hmm.
to make a CT scan for your breast or for your body to see an extension of this
Mm-hmm.
extension of the tumors to other parts of your body. Okay, we have to make PET scan, some scans for PET scan for seeing the status of your bone. If this
Mm-hmm.
if the tumor extend to your bone, it may cause these symptoms, elevation of the calcium, and make these constipations and
Mm-hmm.
low moods, and will make increase thirst, increase urination. So
All
we
right.
have to make some investigations to confirm our diagnosis. Okay,
Mm-hmm.
first.
All right, Dr. Mahmood, very well done. Really, it was a good attempt because um, until we try, we can't improve. So, very well done. You took courage and came ahead to perform. Very well done. And now, do you need time to think? Because in real exam, they will give you 1 minute to think. So, do you
Yeah.
need 1 minute to think, or can we discuss some DDs and investigations and management?
Okay.
So, you are ready?
Yes, I'm already.
Okay, so what is your diagnosis?
My diagnosis is cancer metastasis, primary breast cancer. Secondary, maybe the first I will build bone metastasis, bone cancer.
I
Secondary
mean,
to the breast.
so you want to say that this lady has constipation due to
Yeah,
hypercalcemia, due to
hypercalcemia. Yeah,
due to
due to
metastasis or whatever.
metastasis. Okay, yeah,
Hmm.
from
Right,
the metastasis coming from the primary tumors in the breast. Okay.
right. So your diagnosis is constipation
Ah,
due to hypercalcemia, which may be,
hypercalcemia. Yeah.
yeah. So this is your diagnosis because
Yeah.
cancer is not your diagnosis. Your diagnosis is constipation due to hypercalcemia or
Yeah.
hypercalcemia induced constipation due
Yeah.
to primary cancer or metastasis or whatever,
Yeah.
right?
Yeah. Yeah.
Any differential diagnosis you want to give?
I uh, I bought I will put I will put endocrinal disorder, hyperparathyroidism, but I ask for the lumps or bumps all over the neck. Okay, as a second. Okay, I will put
Mm-hmm.
I will put
You very good.
sarcoidosis,
Sarcoidosis
but
can
there is
cause
no chest symptoms or no skin rash. So
no problem.
okay. I will put also put excessive calcium intake, but there is no drug history of taking calcium or vitamin D or
Mm-hmm.
excessive milk products.
Very good.
Okay, I will put also. I will put I will put this three or four diagnosis for differential diagnosis. First, I will put cancer, bone metastasis. Second, I will put hyperparathyroidism. Third, maybe I will put sarcoidosis. But the first is hypercalcemia secondary to metastasis of the breast cancer.
Very good. Anything else? I mean, you were asking the patient about weather preferences. So anything? Why you were asking that weather preferences?
Whether yeah, I want to check about the hypothyroid symptoms. Okay,
Okay.
but against
So
this, there is weight loss. In
very good.
hypothyroid symptoms, there is constipations with obesity and low moods, okay, and cold intolerance.
Very good. And this lady has diabetes.
Yeah.
Can anything secondary to diabetes can cause constipation? Though the diabetes
Yes,
was
yes.
well controlled,
Yeah. Autonomic neuropathy may
very
make autonomic neuropathy. But from I asked any pain during movement for intermittent claudication, any chest pain, any racing of heart. There is no chest pain. There is no ischemic heart disease before. As I said, I asked her for any family any medical history of long-standing disease. There is no. She said no. There is no
very
heart problem. Okay, so there is no blood vessels. There is no the blood vessel macrovascular complications and the microvascular complication is not seen in this case. So I don't want autonomic neuropathy. Autonomic neuropathy
so
is
very well done, Dr.
coming.
Mahmood. Very well
Yeah,
done, very well done. So this is the style, this is the way you will tell your differential diagnosis in the exam. You will say that well, this lady has most likely constipation due to hypercalcemia, maybe from metastasis of breast cancer or whatever. My other diagnosis was hypothyroidism, but
yeah,
this lady has no cold intolerance, and she has weight loss rather than weight gain. My other DD was
yeah.
sarcoidosis, but she has no other feature like rash
Yes,
or
yes.
joint pains or dry eyes. My other DD was diabetic autonomic neuropathy, but against it, the diabetes seems to be well controlled, and there is no other feature suggestive of any complication of diabetes. So,
Yes.
this is the way, because what is DD? DD is basically a thing which can mimic with your presenting complaint. Okay, but please
Yeah.
remember, not all the DDs are actual diagnosis. Not all the DDs are actual diagnosis. So you will just mention that I was thinking about this. So I was thinking about this, and this is a positive feature. So I put it in. This is in rule in. So I this is the diagnosis, and these are the negative features which are, I mean, these are the positive features, these are the negative features which don't support, so they rule out the other DDs.
Yeah.
So most, yes, so this is how you will tell the examiner. So what is your management plan?
Okay, my managed plan, patient education, patient counseling, psychological support is very important in this case. Okay. Psychological support, psychological support, and specific uh, management I will transfer him to multidisciplinary team of oncology doctors, okay, for to make more investigations and see the extensions of spread of the cancer and the stages of the cancer. According to the stages of the cancer, we will see it need surgical treatments or needs chemotherapy or radiotherapy according to the extension of the cancer in her body after staging.
All right,
About the
all right.
hypercalcemia, I will give her intravenous fluid, okay? Intravenous fluid, and I will give her calcitonin for removing it for treatment of the hypercalcemia, but I have to treat the cause.
Okay, and you are going to admit here or not?
Admit here, I will. It's not urgent. Not urgent. We have to take an appointment, and it has to come to make more investigations to confirm our diagnosis and start the treatment.
Okay, all right. So really, I'm sorry, I forget to discuss investigations with you. How are you going to investigate?
Investigation, basic investigation, CBC,
Mm-hmm.
kidney function, electrolytes, liver function test, serum calcium is very important
Mm-hmm.
in this case. Parathyroid hormone, serum calcium, okay, CT staging uh, for seeing the chest and the abdomen, okay, and the a bit scan for bone, okay, PET scan, also X-ray for the bone. It's very important in this case. Okay.
Okay,
Uh,
very good.
okay.
Okay, any other scan you want to do?
Okay. CT
I
scan
think
and PET scan for
well, yes,
the
yes, very good. PET scan we can add. Any other blood investigation along with calcium? If you remember, when we send calcium levels, we do send one more investigation along with calcium.
parasithyroid hormone, calcium and
Okay,
parasithyroid hormone,
we
alkaline
usually
phosphatase
send
hormone, alkaline
we usually
phosphatase.
send we usually send calcium and albumin together because we have to adjust calcium level according to the albumin level. So when you
Yeah.
mention calcium levels to the examiner or whenever in your life you are sending calcium, always send albumin with that. Okay, so okay. Um, anything in the management which you would like to tell the patient?
The management
General measures, I mean.
general patient educations. I will
Mhm,
educate the patients about the cases, okay, about the cause of constipation. I will
mhm.
make psychological support for her because this calcium make depression that it's coming with depressed mood. So psychological support is important for this
Anything,
social worker. Okay, it's very important.
anything, anything the patient is taking, and you will like to advise not to take, because whenever we
I
find some offending agent, something that can aggravate the problem, we have to identify it and then we have to stop it, because this comes under the heading of clinical judgment. So anything you think patient should be careful not to take
Yeah,
over the counter.
any calcium pills, any alkaline agents, okay, such as cheese, milk, okay,
So the patient was taking antacids. She told you she is taking
yeah,
antacids, I think. And
yeah,
antacids, can take calcium and ammonium, I think.
aluminum,
So
yeah.
yeah, so we
So
need to
good, yeah.
advise her that we need to
So this
advise her that
antacid, yeah,
please don't take over the counter medication, and whenever you need any medication, especially
yeah,
antacids,
yeah,
don't take them because they may contain calcium and then they may worsen, because we
yeah,
suspect hypercalcemia. So whenever in exam you find anything that is aggravating or worsening that can contribute, so please stop it. It comes
yeah,
under the heading of clinical judgment. So overall, I think very well. You took the courage to perform, and it is good. There are few things which we can discuss. Number one, whenever you have this, when you start your history, definitely you will do introduction. You will set an agenda that we are here to discuss your health condition, and then we will discuss the management plan. And then you say, may I know what brings you to the hospital? And then you say, I'm sorry. Definitely these all things are here, but then you elaborate the history of presenting complaint very well. And then after elaborating, you ask the system involved. Okay, so this is part of the clinical communication skill. uh, in the beginning, I will unmute all so that there is no noise. I will mute all, sorry, not unmute. All right. So whenever you have any history, you will start from presenting complaint. And what was the presenting complaint? Constipation. So generally, if you don't remember anything else, you can do this mnemonic, which is quite common: onset, duration, progression, aggravating, and relieving factors. Okay. Uh, what is how I started? It is getting worse. It is getting better. What makes it worse? What makes it better? All these things you can ask. But there are a few specific questions which we must not miss in constipation. Please remember that you know constipation basically is a subjective symptom. So there is no pet definition what is constipation. Mostly people, the range of bowel activity may be 3 stools per day or 2 3 stools per week. So this is quite a subjective feeling, quite a subjective thing. But overall, this varies from person to person. But overall, if someone has less than 3 stools, 3 bowel activities per week, it is known as constipation overall. But it may vary person to person. But overall, in most of the books, you will find that if the bowel activity is less than 3 per week, it is constipation. So for this reason, whenever you have constipation, whenever you have diarrhea, must ask the frequency. I mean, you ask it, but quite late. So you should ask in the beginning, well, before 6 months, how much stools you passed per day, and now how much stools are you passing nowadays, to get an idea that it is constipation or not. Then definitely the consistency and the patient told that yes, she herself told you that the stools are hard. 2 3 more things you can add on. Sometimes this incomplete evacuation, tenesmus, patient think that they are constipated but they have tenesmus. So you can ask, do you feel like there is a sense of incomplete evacuation? So this rule it out. Straining is very important to ask. I mean, this is just a pet question for constipation. Do you have to strain? Like, right? Straining, very important. And then definitely, do you pass any blood? This question comes later on. But the next one is very important. Do you have any pain while you pass stools? Or does it hurts you when you pass stools? Because what is the advantage of it? Local causes like anal fissure. If you remember, anal fissure basically is not a cause of constipation which is treated on medical floor. It is basically something surgeons do. But local causes, I mean, pain while passing stool, does it hurt when you pass stool, is very important. You must ask these questions because we have to elaborate the presenting complaint. And you did it. I think one very important thing in constipation is definitely the general things, fluid intake, how much fluid you take, very much important. Then is the exercise or physical activity, I must say. This is also very important, physical activity. Those people who are physically active, they do have regular bowel movements, and those who are lethargic, they have less bowel activities. Diet, very important. So you will elaborate the constipation, like uh, onset, duration, progression, and so on. Then you will ask about straining. Then you will ask about incomplete evacuation. And please never miss the local causes. Do you feel pain? Does it hurt when you pass stools? To rule out the anal fissure, though it will be managed by surgeons, not by us. And general things like fluid activity, all these things. Okay, and then you will jump on to system involved, and system involved is GIT. In constipation, you will ask detailed GIT question from head to toe. Head to toe, I mean, not head to toe, but I mean, whatever comes in the GIT, like yellowness of the eyes. Do you have any sores in the mouth? Any difficulty in solving? Any pain in solving? Any heartburn? Do you feel sick? By sickness, I mean nausea. Do you ever thrown up? Have you ever thrown up? By throwing up, I mean vomiting. Okay. And any heartburn, any acid rash, any tummy pain, any tummy swelling, any bloating, any early satiety. Do you pass blood in the stool? And does your constipation alters with the diarrhea or any loose stools? Some people do say, ask about worms. Do you ever pass worms in your stools? But it's up to you. Not so common cause of, anyways. So this is basically a scheme which you will follow. I have just sent a message in the chat. Dr. Mahmood, if you can just read that, because this is the scheme you have to follow. As I always say, examiners are very keen in the beginning. They will look at you and they will listen to you. And everyone is keen in the beginning. The concentration is full. So your start should be very, very good. Okay. Then what else you can do? Okay, when you have constipation, and especially this old age, like 62, so please remember that, and one more thing, please remember that when you have a second symptom, like in this case, you see one is patient is having stools, hard stools. Second is patient is weak and cachectic. So this means she is weak. So so whenever you have any other symptom, any other complaint given in the scenario, this is the scenario. So treat it as a presenting complaint. I mean, so this is the hard stool is the first presenting complaint, the major one, and you should treat this weakness and cachexia as a second presenting complaint. Okay, for example, if they give you this lady is hypertensive, this lady is diabetic, so you should treat it as a second presenting complaint. So after you finish with this one, move on to this one. Well, I understand you have weakness and weight loss. Since how long? Okay, okay. It is intentional, unintentional, whatever. How much kilos you lost, how much time, whatever, whatever. So weight, okay. So weight, it. I mean, weight loss is a constitutional is a constitutional. Weight loss is a constitutional symptom. So after that, you should because it is a second complaint and it is a constitutional symptom. So after that, you should ask detailed constitutional symptoms like high body temperature, fatigue, weight loss, rash, lumps and bumps, and sleep problem, sweating, mood. All these all these things you will ask. So okay, so in this way you will proceed with the scenario. Otherwise, it was a fine attempt. Uh, so regarding constipation, please remember that whenever you have constipation in comparatively, I mean, older people or whatever, so you should never miss malignancy because this is the most common, I mean, topic, like hypercalcemic induced constipation, I should say. It is the most common. So then if you find like this is a lady and she is having constipation, so you should rule out like causes of hypercalcemia if possible, like sarcoidosis, like malignancies, uh, like you can also rule out like for example multiple myeloma, like for example secondary metastasis from breast cancer. So these are the because it is most common. Other you can find hypothyroidism, and you try to rule out hypothyroidism, which is also common, and definitely diabetic uh, autonomic neuropathy, because the patient was having diabetes. So basically, rule out hypercalcemia and hypothyroidism. Hypercalcemia may be due to any other systemic disease like sarcoidosis, may be due to malignancy. Malignancy may be primary or secondary, and also you can rule out diabetes because in this patient she was having diabetes. And never forget to ask about this one local causes of constipation. You will rule out local causes of constipation like anal fissure. All right. So drug history is important in this case because some drugs they can cause constipation. Mostly the drugs which are anti, like I should say, anticholinergics, okay, antihistamines in some side effects, anticholinergics, antihistamines, anticonvulsants, even iron containing, they can cause constipation, antacids because they can worsen because they have calcium. So always ask medicine history in detail. So this is how we will deal constipation. Um, Mostly when you will elaborate the presenting complaint, you should get a hint that in which direction your patient is going. And this was basically hypercalcemia induced constipation. And in the investigation, always mention, because in station 2 we have to take a patient as a whole. So I mean CBC, LFTs, RFTs, thyroid function test, calcium, aluminum, PET scan, all these things you can do. And the management, definitely we have to do three things. We have to correct constipation. So we may give some laxatives, osmotic or whatever feasible. We have to correct hypercalcemia, and because definitely we may give like hydration. It depends upon. Normally, calcium level can be treated OPD basis, but if it is more than 3.5 or the symptoms are severe, then definitely we can admit the patient. But otherwise, we can manage on OPD basis. And PET scan, definitely we need to treat the cancer, for which we need to refer the patient to the endocrinologist. So this involves the management. And one more thing I should tell you, that when you get hypercalcemia, because when you get a hint that this man or lady, someone is having hypercalcemia, then please remember these 5 symptoms or 4 symptoms. Serious, because it can have some racing of the heart or ECG changes. You can also remember CNS, have some depression. You can also remember renal symptom, can cause polyuria, polydipsia, stones, can cause tummy problem, and I mean this one, abdominal pain, constipation, heartburn. So whenever you find hypercalcemia, any hint, your symptoms should, focus on these four. I mean, your systemic review should focus on these systems. Okay, and they are the theme. So very well, Dr. Mahmood. Overall, it was good. Okay, so now we finish with this case. I think. Yes, Dr. Rania, you have any question?
دكتور تنزيل السلام عليكم.
Walaikum Assalam, doctor.
Thank you for this good session. And I think for Buhari, he's not here, but I have to comments. He did well, but he mentioned jargon twice.
Oh yes,
And
you're right.
Brian American epigastric pain. And
Yes, yes, you're right. Yes.
maybe
Even,
this is distract from his and other things. When the patient say that she has breast cancer and underwent chemotherapy, and he has to use empathy and sympathy for the patient, isn't it?
Very good, doctor. Thank you for reminding. I was writing on the paper that he is using jargon, epigastric
Yes.
pain, all these things. Yes, don't use jargon. Yes, and he also used GIT, and whatever. Anyways, you're right. It is better, and yes, it is always important. Please remember two things. Number one is, as the doctor mentioned, sympathy and empathy. Right? If someone says my mother died, if someone says my father died, whatever, you will say I'm sorry. Okay. And second thing is explore. I think this was also lacking in the performance. Whenever in station 2, the patient tells you any other complaint, like the lady told I had breast cancer, So it is our job to rule out, to explore it more, when, why, what happened, which treatment you took, are you going for follow-ups? If someone says, I have chest pain, at least we should stop and ask 2-3 questions where quality radiation. So whenever a patient tells you a second complaint in station 2, you have to explore it. You can't escape and you can't go to the next level, to the next question until you explain the symptom which he is telling you. But you can omit it in station 5 because it is less time. So when the patient tells you anything in station 5, any new symptom, it's okay. If you have time, you can explore it. Otherwise, you can just ask, I'm sorry, since how long? But in session 2, you will explore everything, whatever the patient tells you. You are very right, Dr. Rania. I agree with you. So anyone has any comment? I think there was one other doctor who was raising the hand. Okay.
Doctor,
Any other?
thank
Yes,
you,
please.
doctor.
Yes. Yes,
Yeah,
please.
what's the cutoff for admission, like serum calcium cutoff for admission for the IV fluids and diuretics?
Well, it depends upon overall, because the serum level above 3.5 is usually considered as a serious or severe level, and we must admit 3.5 millimole per liter. But the symptoms can come when the serum calcium is 3. So it depends upon the clinical presentation. Overall, we take it as severe when it is more than 3.5 millimole per liter. You got my point?
So when we're asked about the admission, we would say like it would depend on the serum calcium level, no? Or
Well,
like
basically
symptoms now.
Well, the patient has no cocktail of symptoms, like he has only the constipation, heartburn. So if the patient has severe symptoms like racing of heart, like palpitations, and you feel that he is, and if the investigations are given, he is hemodynamically unstable, you can admit, no problem. Always take the safe path. But if the patient is doing well, she is constipated from last 6 months, I think she can manage for a couple of more days and we can manage on OPD basis. But if she is definitely more sick, she has no social support at home, she lives alone, then it is not wise to send her home. But this lady was living with her family, no issues. So this lady, I think we can manage on OPD basis.
Thank you so much.
So basically 2 things you have to consider. Social things, if someone is alone and no one is taking care of her or him, and if the calcium level, I mean, the calcium level will come after investigations, no doubt. But if the cocktail of symptoms is there, patient has multiple symptoms, definitely, or the vitals are given, patient is unstable, or in the end, if calcium level is more than 3.5, right?
Thank you so much.
Dr. Tanzil, if he dehydrated also, if he's
Yeah,
severe.
dehydration, definitely. Dehydration is always a red flag. Dehydration, like in diarrhea, overall, I mean, dehydration, low blood pressure, shock, high grade fever. I mean, if hemodynamically unstable, I mean, then definitely we can't take a risk. All right.
Doctor also mentioned calcitonin and bisphosphonate.
Yes, you're right. For hypercalcemia, if it is not correctable with IV rehydration, we can then move on to IV. But for IV therapy, we must admit, if we want to give IV therapy, we must admit the patient. Right? It is okay, doctor. You got my point?
Yes, doctor. Thank you so much.
Okay. So I think it was a good discussion, but please remember that you have to rule out some local causes of constipation. I mean, if you remember from the final year school knowledge, knowledge from medical school, final year knowledge, we know that people who have anal fissure, they tend to be constipated because they have pain while they pass stools. So always rule out local causes and always focus on diet, physical activity, fiber, fluid intake. And if the patient is unstable, he is hemodynamically not good, and she or he lives alone, admit him or her. Otherwise, constipation we can manage on OPD basis. So, is there any other question or anyone wants to add in anything, any suggestions? All right, so I think we should stop the recording.